Hi everyone. Doctors are the gatekeepers of our medical health, and they also play a very important role in psychological health and well-being as well. And most of the doctors that I know are caring, conscientious professionals who genuinely want to help people and want the best for their patients. But over the years, I've also heard from clients and comments on a number of my videos about people feeling like their doctors seemed detached, don't believe them, or simply don't care about them. When physicians lack empathy, it can have life and death consequences for patients. And in today's video, I'm going to be talking about the results of a fascinating new study that explains how medical school training may actually train doctors to have less empathy. But before I get into that, just a couple of disclaimers to go over. I'm a registered psychologist in the province of British Columbia, Canada, and this video is for informational purposes only. It is not intended as a substitute or replacement for advice from your doctor or mental health professional. So, with those things out of the way, let's start talking about doctors and empathy. Now, there was a fascinating study published in the British Medical Journal in April 2023 that examined what the researchers called a hidden curriculum in medical school that reduced the empathy in medical students. Now, at its core, empathy is the ability to understand and share the feelings of other people, being able to place yourself in the shoes of another and understand what they're going through, being able to relate to another person's difficulties and pain. Now, it's well known that a lack of empathy in healthcare can lead to catastrophic and disastrous results, contributing to hundreds of avoidable deaths. But why does this happen, and how does this type of thing happen? Empathy is a core skill that all medical students and doctors require, and it's often central in medical school training. So it's not like doctors don't get training in empathy. In fact, the ability to be empathic is often an important selection criteria for who becomes a doctor. Most people who go into medical school pursue a career in medicine because they're caring and empathic and genuinely want to help people. So what you end up with is people who enter medical school who are probably more empathic and more caring than the average person. And you would think that with the focus of empathy in medical school training, that doctors would actually get more empathic through their medical school experience. However, the authors of this study found that empathy in medical students actually declines as the doctor progresses through their training due to what they referred to as this hidden curriculum. And to understand how this happens, it's important to understand how the training of doctors changes over the course of medical school. Typically, the first phase of medical school is mostly lecture-based, where doctors learn about the body, how the body works, disease processes, that sort of thing. But as the doctor in training goes through medical school, the second phase of their training becomes much more clinical and involves more interactions with patients, and this is where things begin to change. As the doctor in training gets more hands-on, patient-focused training, they're exposed to influences that can begin to affect how they think and relate to patients. For example, there's often a shift and unbalanced focus on what's referred to as the biomedical model of disease. Essentially, the biomedical model of disease views the body as a machine, like the patient is a car and that there's something wrong with the car that needs to be fixed. The patient gets viewed as a bunch of organs, muscles, tendons, and bones that are misfunctioning and that need to be fixed by the doctor. And this is in contrast to the biopsychosocial model of disease, which focuses on the patient not just as a biological organism, but as a person, recognizing that psychological factors and social factors can play a role in how that person is feeling and how that person is experiencing their health and physical condition. So the doctor is being trained to focus on the functioning of the individual's heart with less focus on other factors that could be playing a role in the patient's presentation. Things like anxiety about their health or social and cultural factors that are at play. Additionally, the way medical students are taught and the way their curriculum is structured in these years of medical school training can also play a role in sapping empathy from doctors. We've all heard horror stories about the crushing workload and stress that doctors experience, and that's particularly magnified in medical school training. You hear stories of medical school trainees doing 24-hour shifts, even though we know that something like that would greatly reduce the effectiveness of their care for patients. This crushing and stressful workload can also be promoted by the influence of their trainers and role models who may show little empathy themselves towards the trainee and patients. Essentially, the doctor who is training the medical student went through this same brutal and punishing training experience, and so they pass this on to their trainees, and what this does is it creates a self-perpetuating negative cycle. Another factor that the authors highlighted in the study is that doctors in training often have little experience of what being a patient is actually like. So the doctor approaches these interactions with the patient from the perspective of someone who studied a particular medical condition, but may have little real-world experience with that medical condition and how that medical condition may affect the overall well-being of the patient. And this can contribute to the doctor in training becoming more cynical, emotionally distant, and emotionally desensitized from the experience of the patient. And this further lowers empathy. So what can be done about this? Is it possible to reverse this process whereby people who enter medical school can maintain and actually develop greater empathy over the course of their medical school training and thereby become more effective at treating patients? Well, the authors of the study provide a number of recommendations to help build and foster empathy in the training experiences of doctors. And what they recommend is that doctors in training get to experience some of what it's like to be a patient, essentially walking a mile in the patient's shoes. This can be done by having doctors spend the night in an emergency room following what it's like to be a patient presenting an emergency. There have been some recent efforts by researchers at MIT who've developed what are called age simulation suits that help people better understand and experience the aging process. And training doctors could have experiences wearing these age simulation suits to get a better sense of what it's like for some of the older patients they might be working with. By providing medical students and training doctors with these experiences of what it's like to be a patient, this can help them develop greater empathy when they're interacting with patients. Another recommendation from the authors focuses on medical training balancing the biomedical model with greater education and focus on the biopsychosocial model of disease. Essentially, viewing patients as more than just organs or tissues or nerves, but rather complex beings consisting of physical, psychological, and social components that all play a role in their experience of disease. A greater focus on the biopsychosocial model can help foster greater empathy in doctors. Another way to potentially develop greater empathy is to bring real patients into the classroom in that first phase of medical school training, when doctors in training are learning about body and disease processes. By bringing patients into this phase of the training experience, this can combine real-world patient stories with the medical information that the medical students are learning about the human body. And this can help make the transition from classroom lecture-based learning to learning in clinical settings and hospitals much less jarring for the doctors in training. Essentially, they start to learn about patient experiences during that early foundational lecture-based training, and so they have a greater appreciation for what a patient experiences when they actually start working with people in clinical settings. We can also build more empathy in doctors by focusing on training in empathic communication. Now, all medical training programs teach communication skills, but the effectiveness of this training varies, and so not all doctors are trained in the same level of empathic communication. Things like expressing understanding of what the patient is telling the doctor, nonverbal behaviors like nodding, leaning forward, appearing engaged with what the patient is telling the doctor, expressing a sense of optimism and hope to instill in the patient. Now, we've all heard horror stories of doctors with terrible bedside manner, and so training doctors to be more present and human in their interactions with patients can be really, really helpful. Finally, the researchers recommend that training doctors can benefit from exposure to empathic role models and peer support to foster greater empathy. Role models in medical training have a strong influence on trainee behaviors and attitudes. So if the doctors in training are working with supervisors who model empathic behavior and understanding towards patients, this is more likely to enhance the empathy of their trainees. And so this might require training efforts to enhance empathy in experienced doctors that medical students will encounter during the course of their training. So the good news is, in all of this, is that there are solutions, and that with effort and willingness to make some of these changes in medical school training, you can experience greater empathy in doctors. And that's the ultimate goal, because this will in turn improve the overall well-being and care of patients. And this can be particularly important in conditions like health anxiety. And if you want to learn more about health anxiety, I'd encourage you to check out this video. So that's all for today's video. As always, thank you for making it all the way to the end of this video, and I will see you in the next one.